Good afternoon, everybody. Happy Saturday to you. It is day 47, I think, today of my 90-day vlog challenge. Take these off so I can see you properly. If you've not seen my videos before, of course, I'm Tess Crawley. I'm a clinical and forensic psychologist. My practice, Dr. Tess Crawley and Associates, is based in Hobart. We have an office in Launceston and lots of rural outreach in Tasmania. But of course, being Facebook, there are no boundaries to the people who can join me in these live streams. And I see Shelley's with me this afternoon. Good afternoon, Shelley. I'm just going to be looking at my laptop for a second. What I have to do when I want to share this stream into the Stigma Rebellion group, closed group, I need to be live before I can do that. So I'm just about to do that now so that those who are members of that group, and membership, it's called a closed group. That doesn't mean it's closed to members. It just means that it's a bit more private. So Shelley's saying hi. Hi, Shelley. So if you would like to be a member of the Stigma Rebellion, which is our closed sort of private group, so that people outside of the group can't see what comments you make, then please feel free to join the Stigma Rebellion. So I'm just looking now to see that this live stream is live on my page, and there it is. And then I will now share it into the Stigma Rebellion. Bear with me, technology. Let's have a look. So I go to share it to a group, and we're looking for Stigma Rebellion, and there it is. And we're away. Okay. So hopefully those of you who are watching from the Stigma Rebellion can do so. Shelley's saying the kids are yelling hi at you and they think you can hear them. I can't hear you. I can't hear you, kids, but I know you're there. And thanks for saying hello to me today. And I do miss you guys terribly. All right, so this afternoon I'm following up on the video I did yesterday, which was about the condition known as borderline personality disorder, or BPD. Emily asked me yesterday for some stats on BPD, and so I have found a really good website. I don't know if you've heard of Sane Australia, S-A-N-E. It's hard for me to say Sane Australia because I have a bit of a lisp. But Sane Australia, I'll post the link into the comments when I'm done today. But Sane Australia is a great website, mental health website with lots of resources on lots of mental health conditions. And they've got some good stats there on borderline personality disorder, because of course this week we're coming up to the end of BPD Awareness Week for 2017. So for those of you who didn't see the video yesterday, I have in the past worked quite extensively in adult community mental health and also in the Tasmanian prison system. Actually, I also worked briefly in the Queensland prison system too, and I've worked with a lot of clients over the years who have had diagnoses of borderline personality disorder, both males and females. It is a condition predominantly diagnosed in women, and it is a condition that is typically associated with childhood trauma and is linked with rapid and extreme mood swings, with fear of abandonment and extreme efforts to avoid being abandoned in one's life, relationship difficulties, difficulties in identifying or maintaining a strong and stable sense of self. People with borderline personality disorder often are labelled lots of things. There's a lot of stigma around the label of borderline personality disorder, and I think that that's why it's so important that initiatives like BPD Awareness Week are in existence, because it's incumbent on those of us who know more about the condition to talk openly about what it is and what it's not, so that those in the community who might have heard of it, or even if you haven't heard of the condition and you hear me talking about this condition, you might start to perhaps even have a better understanding of those members of the community around you who might have features of this condition. Now, I'm not saying that they necessarily meet the criteria for this condition, but if someone you know has lots and lots of mood swings, or if someone you know is labelled as a manipulator or an attention seeker, I'm hoping that having a better understanding of borderline personality disorder might have a flow-on effect for you to also have a better understanding of just other people who have some of these features, perhaps not necessarily meeting diagnosis, but perhaps having some of these difficulties in their own lives. So by talking about these conditions, we do a couple of things. We reduce the stigma about the condition itself, but we also broaden our understanding in the community of a whole range of personal features. So Emily yesterday wanted to know what was the rate of or the stats on borderline personality disorder, and I mentioned the magic 1%. So when you're studying psychology, it seems that every diagnosis is magically falling around the 1% of the population. So about one person in every 100 has whatever diagnosis you're talking about. So no matter where you go, there's going to be many people around you really who have one mental health condition or another. And of course, part of breaking down the stigma around mental health conditions is understanding also most of us will at one point or other in our lives have some kind of mental health challenge. It might be an episode of anxiety. It might be a significantly profound episode of grief. It might be depression following the birth of a child that, you know, once you've got your skills and your sleep back on track, fades in time. Or it might be that you have a workplace incident that causes you some trauma. Most of us at some point in our lives will have some form of mental health challenge, which may or may not meet a full-blown diagnosis. So, magic 1%. Now, according to the Sane Australia website, they're a bit more generous. They say between 1 and 4% of the population are affected by borderline personality disorder at one time in their lives, at some time in their lives. It's typically presenting or becoming apparent that these symptoms are existing at around adolescence. So yesterday I talked a bit more about what borderline personality is, and I talked a little bit about how it stems out of some survival strategies that children employ when they're living in a very difficult family environment or upbringing. So we think about children who are living in traumatic environments, neglectful environments, and even emotionally neglectful environments. So for some of the borderline clients that I've seen in the past, they've described having an ideal childhood, but when we scratched the surface, we found that it was very much an emotionally impoverished childhood where they weren't really allowed to express their feelings, they weren't allowed to show any kind of emotion, and they certainly weren't validated. So the literature on borderline personality disorder actually talks a lot about both a traumatic childhood but also an invalidating childhood. And what that means is a childhood where your voice is irrelevant, your emotions are irrelevant, your experiences are irrelevant. It's almost as if you don't exist. So again, same outcome as a management strategy that a child in a traumatic environment might employ ends up being employed by a child in an invalidating environment too. And that is, my emotions don't matter, therefore I'm safer not feeling them because it's too painful to manage them on my own. So what then happens is that those emotions get squashed down. And again, you know, adolescence and adulthood, we then see, you know, an individual who just can't tolerate or manage their own emotions. So I wanted to I've talked a little bit already about the stigma associated with borderline personality disorder. That stigma really stems a lot from some of the behavioural outcomes of having borderline personality disorder. So individuals with borderline personality disorder often, we've mentioned wild mood swings, so people around them find it really hard to understand and to tolerate those mood swings. I've touched briefly on the notion, this is in yesterday's video, that people with borderline personality disorder are often at risk of self-harm and suicide. So those behaviours are also seen as, mistakenly seen as being an attempt to manipulate other people or an attempt to seek attention. Now those two labels, manipulator and attention seeker, get levelled at people with borderline personality disorder a lot. when I was lecturing at the university, when I was treating people with borderline personality disorder, when I've been running workshops, anything that I've done where I've talked about borderline PD and I've talked about self-harm, I've done what I could to try and dispel those two myths in particular. So, as I said yesterday, self-harm is often about trying to shut down and manage one's own inner pain, not being able to tolerate one's own emotions, not being able to manage them, finding them quite frightening and intolerable, and seeking any means available to end those feelings. Now, that obviously affects other people, but it's not coming from a place of wanting to manipulate other people. Now, sometimes because relationship skills are also impaired, typically in people with borderline personality disorder, the way they talk might look like it's manipulation or attention seeking, but really sometimes those behaviours are a manifestation of that desperate attempt to not be abandoned. They're so frightened of abandonment that they will resort to desperate measures, if you like, to try to feel validated and to feel real and to feel like a whole person by keeping those close to them, around them. So as I said yesterday, when we start to look at those labels, attention seeking and manipulator, we can then start to recognize that what looks like an attempt to manipulate us is actually an attempt to communicate with us. I feel so desperately frightened that you will leave me that this is what I'm prepared to do. Or I feel in such desperate pain emotionally that I can't cope with, so this is what I'm prepared to do to try and end that feeling. So when, as a therapist, one of the key things I work with when working with clients with borderline personality disorder is actually about teaching a range of skills, and I'll talk more about that skill development stuff in another video because it's quite a lengthy topic. But I work very solidly on setting boundaries and maintaining those boundaries, and that's something I've also tried to teach to people who live closely with people with borderline personality disorder. To set boundaries and to maintain those boundaries. Consistency is key. So something I've often said when talking about this label of manipulation and attention seeking, I have never felt manipulated by one of my clients with borderline personality disorder. I have never felt that a client has tried to get me to do something that I haven't wanted to do. They might have asked for things that were inappropriate, and I've been able to say really clearly that's outside the boundaries of what we're able to do. And when I'm clear in what my boundaries are and when I'm consistently applying those boundaries, there's no question, there's no argument, it's quite clear, everyone understands. So I think that's really an important message too for those who have people in their lives with borderline personality disorder, is to seek some help in learning how to set boundaries and maintain those boundaries. And you can do that in a caring and empathic way. You don't have to be cruel and harsh in order to do that. You can do that in a sensitive and caring way, but it does take a little bit of practice. There is a book, it's probably, well, it is quite old now, and the book is called Stop Walking on Eggshells. And so people who have someone in their lives who has borderline personality disorder, they often describe this feeling of it's like I'm always walking on eggshells around them. I don't know how to be, I don't know how to respond, I don't know what to say, I'm always going to get in trouble. So it's really important to do what you can to learn some skills around boundary setting and maintaining those clear boundaries. And then everybody knows where they stand. So if you understand that individuals with borderline personality disorder have missed out. Oh, hi Kim. Kim's joined me too. If you understand that people with borderline personality disorder have missed out on a whole lot of skill learning in childhood that the rest of us take for granted. So they've missed out on how to how to learn to tolerate one's own inner world, so one's own emotions. They've missed out on how to learn to make and maintain relationships, so through normal friendship development in childhood, because they're too busy surviving their own childhoods. They've missed out on skills around how to get your needs met, and they've also missed out on learning that your needs can be met. So a lot of these kids have grown up in environments where their needs are they're never going to have a hope of getting their needs met emotionally or in some cases physically as well. So they don't know how to ask appropriately for things. Now, it's not like it's an intellectual situation. It's an emotional, emotionally driven condition, built on a foundation of a lack of skills that like I said, lack of skills that the rest of us take for granted. So once we understand that, we can start to be, I think those of us around the person with borderline personality disorder can start to be a lot more tolerant and understanding of the more extreme elements of living nearby that person or close with that person with borderline personality. Now I'm just going to have a quick check and see if I've got any questions in the Stigma Rebellion, because that's on a separate page and I'm not looking at it just at the moment. And I don't want to miss any questions because I know this is a tricky topic, and I know a lot of people are really fascinated by this topic as well. Okay, any questions? No comments or questions. Cool, that's good. You're all listening intently then. Or you're out doing your Saturday afternoon thing, which is a very good thing indeed. So myths around borderline personality disorder. I think there are lots of myths around self-harm and suicide risk as well, which I am going to do a separate video. I said yesterday I'll do a separate video on self-harm and suicide risk, because I think that one needs to stand alone with lots of trigger warnings attached to it. But because of the strong association between borderline personality disorder and suicide risk and self-harm risk, sometimes the seriousness of the risk in that individual can be overlooked. So people sometimes, again, that's that attention seeker stigma. So when things are brushed off as being an attention seeking act, we can accidentally overlook the seriousness of what's going on for that individual. So I think, you know, when you think about the harm that mental health stigma does generally, in terms of it prevents people from wanting to talk openly about their experience, it prevents people from sometimes from seeking help, it prevents others from offering help too. I had a client once years ago who came to me, and I've never forgotten her in particular, because I felt that what she did was so incredibly brave. She had a small child, and she came to me and she said, "I need you to assess me for borderline personality disorder because I think I've got it." And so I conducted an assessment with her, and yes, she met the criteria, and we worked really closely together, and she learnt a lot of skills, and she, you know, galloped ahead in terms of how she managed her relationships and her life and her parenting skills and all the rest of it. And the reason why I say that I felt her openness in asking the question about BPD was brave was because one of the things that frightens me around the diagnosis of BPD for parents is that sometimes it's assumed that you can't be a good parent and have BPD, and that's just not the case. You know, a lot of the clients that I've worked with over the years have been working so hard at managing their symptoms so that they can be a good parent, that they end up being an excellent parent by default because they're working so hard at it. Hi Mel, I can see you've joined us this afternoon too. Thanks for coming along. So I think that when the stigma around borderline personality disorder is quite pervasive, it's felt that people with borderline personality disorder have some kind of crazy element to them, and of course sometimes their mood swings can be very extreme, and for some people that can be very confronting to witness or to be at the end of. I think that the history of borderline personality disorder being seen as untreatable, which of course is actually not true, it's very treatable, it has, you know, led to some of this stigma as well. So in a separate video I'll talk about treatment for borderline personality disorder. So even though when we talk about personality we talk about it being a lifelong feature of who you are, people with borderline personality disorder, when they work really hard with a trained mental health professional on appropriate skill development, they can actually reach a point where they're able to actively manage the symptoms of borderline personality disorder. So they might not meet the criteria if they were assessed afresh. So, you know, those features will still be there under the surface, and they quite possibly will need to manage those over time. But the difficulty that causes them gets less and less over time, which is a great thing, you know, for people to be able to seek some help, get some treatment, learn some skills. And the skills that we teach for managing borderline personality disorder are actually skills that we teach a lot of our clients. So it's a lot of skill-based work that's really beneficial to a lot of people. So when I talk about that in a subsequent video, you might learn a couple of things that might be helpful to you. So that's it. I can see I've got 5 people with me today, and a few of you have said hello, so thank you for joining me. I'm wrapping up now. I can hear a little person in the next room doing a little "mommy," so I think I'd best go and see what that's about. I hope you're having a lovely weekend. I hope this beautiful, beautiful blue sky Saturday afternoon that we're having here in Hobart is the same for you wherever you are. Don't forget, if any of these topics that I talk about in these videos are relevant to you or to someone you know, there are lots of options for reaching out and getting some help. You're more than welcome to reach out to us. My practice is Dr. Tess Crawley and Associates. You can call us on 03 6223 2122 in Hobart. But there are also lots of other resources around. So I've mentioned the Sane Australia website today, and I'll put that link in the comments. Of course, Beyond Blue is another great Australian website, and both of those have some good phone numbers there as well for support if that's something that you would like to pursue. If you're liking these videos, don't forget to give them a like, a thumbs up or a share, and let me know what you're thinking. If you want to comment privately, you don't want your Facebook friends and family seeing what you're saying, then feel free to join the Stigma Rebellion, which is the closed Facebook group that I welcome you all to join. And once you're in that group, it's closed as in it's like a little closed community. Once you're in there, then nobody outside of the group can see what you're commenting on. One last reminder, don't forget I'm recruiting at the moment. I've got a position open for a principal psychologist based in Hobart with statewide responsibilities for my entire team, working alongside me as my shadow and right arm. And I've also got a provisional psychologist position available in my Launceston team, and for that position I would like you to have at least 5 years university training. So have a fabulous Saturday afternoon. I'll talk to you again tomorrow. That's all for today. Bye-bye.